It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I have an email from Daniel who says, "Hi Patrick, my grandfather developed sepsis as a result of an untreated UTI. UTI stands for urinary tract infection. He's currently in an induced coma. His sepsis has progressed to septicemia, which is a step backwards. However, he is now on alternative antibiotics, more specific to the bacteria, and they have actually reduced the amount of assistance needed to maintain his blood pressure, oxygen, etc., which I suppose is a step forward. I believe he will pull through. However, the waiting is excruciating. At the moment, I feel like it's just a waiting game." Well, thank you so much, Daniel, for sharing your grandfather's situation. And I have seen these situations in intensive care hundreds of times. I've worked in intensive care and critical care for nearly 25 years in 3 different countries, where I also worked as a nurse manager for over 5 years in ICU. And I've been consulting and advocating for families in intensive care all over the world here at intensivecarehotline.com. And I can confidently say that our consulting advocacy has saved many lives in intensive care. And you can verify that on our testimonial section or on our podcast section, where we have done some client interviews. So Daniel, when someone in ICU goes into a septic shock or septicemia, as you've correctly described it, several things happen. Obviously, the infection needs to be treated as a matter of urgency, right, which is what they're doing now. Ideally, the bacteria gets identified pretty quickly, so the right antibiotic can be used. But what if it's a viral infection or a fungal infection? There's different challenges around that, or there can be different challenges around that. In any case, what also happens then is it's like a cascade of a downward spiral is set off with, patients getting a high temperature, blood pressure is dropping rapidly, heart rate goes up. Inotropes or vasopressors need to be started, keeping your grandfather alive or anyone that has septicemia, because blood pressure is often not compatible with life when septicemia strikes or septic shock strikes. So a number of things need to happen. Like I said, vasopressors, inotropes, fluid resuscitation, often sometimes cortisone is needed. Many patients go into kidney failure during septic shock. Then sometimes hemodialysis or hemofiltration is needed. Mechanical ventilation is needed, induced coma, just like you vividly describe it here. And it is, like you pointed out, it is often a waiting game. And whilst the mortality for patients with septic shock is reasonably high, the reality also is many patients survive. So you are right in saying that, you should think positively, because you can't control the situation at the moment, but you can control your mindset. And I believe you having a positive mindset is very helpful for you, for your family, and for your grandfather. You're bringing in positive vibes when you're visiting your grandfather. And I think that is very important, because that is what you can control. And, even though he's in an induced coma, you can talk to him and you can, tell him you believe in him and you love him and all the rest. And that will help him to pull through it, I believe. So give it some time, be patient. This is something that we see all the time. Families in intensive care are very impatient, and I can understand that. And even intensive care teams are impatient. You've seen that in my videos, what, they sometimes throw at families and the artificial timelines they want to give patients, which never works really. So, give it some time, give it some patience, and make sure they're doing all the right thing. And if you're unsure that they're doing all the right things, you can reach out here at intensivecarehotline.com. We have created a membership for families of critically ill patients in intensive care. And you can become a member for our membership of critically ill patients in intensive care if you click on the membership link at intensivecarehotline.com, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that explain the landscape that is intensive care to you, and it will help you making informed decisions, have peace of mind, control, power, influence, making sure your loved one gets best care and treatment. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I also talk to you and your families directly, and I talk to doctors and nurses directly. And you will see that when I talk to doctors and nurses directly and you're on the phone with me, you will see that the dynamics will change in your favor, because I will ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also offer medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. Thank you so much for watching. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share the video with your friends and families, and you can contact us at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send an email to support@intensivecarehotline.com with your questions. And I also do a weekly YouTube live where I answer your questions live on a YouTube show. And again, you will get notification if you're a subscriber of my YouTube channel. Thanks again for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.